More than 490,000 Americans have died from COVID-19 since the pandemic began. 490,000. And while we are far from out of the woods, there was some positive news today. Health officials reporting a significant decrease in daily cases in the U.S., down more than 72% in the last 6 weeks. That's according to Johns Hopkins University. With that said, experts are concerned about virus mutations. The most common right now is the UK variant, which researchers believe may be even more contagious. Nearly every state in the country has reported at least one case, with many of those cases in California and Florida. And this map you see right here, the darker shade of blue the state, the more cases it is reporting. Now, these new variants are raising questions about how effective the current vaccines will be in preventing infection. And joining us now is Dr. Andrew Neumer. He is an associate professor of population health and disease prevention at UC Irvine. Doctor, thanks for your time tonight. We've got to talk about these variants. I think a lot of people's biggest question is, how dangerous are they?
Thank you for having me back on News Nation. They're not dangerous on an individual level as much as they are for all of us as a population. The B.1.1.7, the so-called UK variant, which your viewers just saw a map of, that is more spreadable. And so we're worried that more people will get COVID before everyone can be vaccinated. But it doesn't seem to cause more severe illness or more mortality on a case-by-case basis. So that's the good news. The B.1.351, so-called South African variant, is a little bit more ominous, but thankfully it's also much less common right now.
So what is more problematic about that South African variant?
Well, it evades the antibody treatments, the monoclonal antibody treatments that we have, and it seems to also evade the vaccine, according to a latest study. Not completely, but the vaccine will be less effective against the B.1.351, and the monoclonal antibody treatments that some of your viewers may have received are less effective against it. So that is one that we need to really keep our eye open for.
How much less effective?
Well, it's about 6 times fewer antibody response, which in the grand scheme of things is actually not that bad in terms of the antibody response is enormous in terms of billions of antibodies produced by our bodies when we encounter a novel antigen. So it's lower, and it's low enough that the vaccine will probably have double digits percentage less effectiveness in the population, but it's not like 0 or anything like that.
So I hear what you're saying. I think a lot of people are concerned, though, about the measures being taken, and if we're doing enough in the U.S. to address the spread of these other variants. Although they may not be as severe, if they are more contagious, then you're just talking about more people getting it and then more people at risk of, frankly, dying from it.
Right, and well, what the News Nation viewers have to understand is we've had these mutations. We've had one in the UK. We've had one in South Africa. The United States is a nation of over 300 million people. We could have a U.S. variant. I mean, as long as we have spreading of the virus and mutation and then more spreading, that's what causes these variants to arise, which is why we need to vaccinate. Everyone who wants to get a vaccine should get a vaccine as soon as possible. And that's going to take action on the manufacturing level, on the state and local level, and the federal level as well. The faster we can get everyone vaccinated, the less concern we will have about new variants or even spread of these existing variants. So vaccination is really the name of the game at this point.
Right. Doctor, we mentioned just a moment ago that there is a study underway for pregnant women, but I'm curious as a parent when the vaccine is going to be available for kids, some of our younger generations and populations, to be protected against this virus.
Right. Well, the segment didn't mention it, but there's also a trial underway in 12 to 18-year-olds. So the vaccine is authorized for 16 and up at the current time. But it will be authorized, I anticipate, for everyone 12 and up, and in due course for probably everyone 2 or 4 and up. They're doing studies on pediatric populations. As a parents who are watching this segment should understand that their children are not really at risk of severe disease. I mean, the reason why we want to vaccinate as soon as we've evaluated the vaccines in kids, the reason why we want to vaccinate kids is to reduce their role in spreading it to other household members. But the parents should be reassured that it's really older people in the household who are at greatest risk.
Got that. All right, some hopeful information there, Dr. Andrew Neumer. Appreciate your time.
Thank you.